Tooth extractions are generally not painful as a natural procedure. So when you go to your dentist, if you're attending for a tooth extraction, we would recommend that you have some food before you go, because when you go for your extraction, the dentist will give you some anesthetic. The local anesthetic itself may be slightly painful, like a little pinch while you're having it, but then generally you will be numb for a few hours afterwards. So have something to eat before you go, and depending on what your dentist says, have a painkiller before you go as well. You won't feel any pain during the extraction because the dentist will give you some local anesthesia as an injection to numb any of the pain for the extraction site. You may feel some pressure as the dentist is pulling the tooth out while you're having the extraction. Generally, most people don't even realise the extraction has been done because it's not a painful procedure as such. After you have the extraction done, there is more than likely to be some bleeding afterwards, so the dentist may give you a pack to bite down on. The anaesthetic lasts for a few hours and it will start to wear off after about 2 to 4 hours, and that's when you may start to notice some pain such as throbbing and shooting pain. If you do have this, then please do take some painkillers. Have a soft diet and just have soft foods, and if there is any bleeding or oozing, then just use one of the packs that dentist has given you, or you can roll up a clean handkerchief and then bite down on that on the extraction site to stop any bleeding. A day or so after your extraction, you can have salty water mouth rinses, continue with your soft diet, and avoid smoking, alcohol, any vigorous exercise, and try and keep the area as clean as possible. You may not necessarily feel any more pain with wisdom tooth extraction because the local anaesthesia that you will be having is exactly the same. However, after the numbness is worn away, if it's a difficult extraction, you may feel some swelling around the tooth and some pain in the area, and some bleeding as well while the socket heals. So we'd recommend that you take some painkillers after the extraction. Surgical extractions are the same procedure whereby you'd go to your dentist and you'd be numbed up with exactly the same local anaesthetic. With surgical extractions, you may have some bone removal from around the tooth and you may have some stitches afterwards. You won't really have any pain during the procedure. However, after the procedure, you may have some pain, so we'd recommend that you take some painkillers and a soft diet afterwards. After you have an extraction, there are certain complications that you can have, such as a dry socket. If you do develop this, which is an intense throbbing pain that develops usually about 24 to 72 hours after the extraction, visit your dentist and let them know so that they can help you. So if you feel anxious about your dental extraction or you're worried about it, please see our content on dental anxiety, which will help you.